And so now let's continue our discussion, or my discussion, with the two AI engines about Syntonics, DeepSeek and ChatGPT. I did want to run a number of questions by them as, let's call it, an objective observer, and I realized that these engines have their own bias and filters. And so I try to work around that and get them to deliver any positive values, negative values. I'm unconcerned about the bias, really, because we have to ask questions from two sides in order to get the best results possible. And so the next question in the series here is, there are nuggets of truth in the Syntonics paradigm that lead people to believe in the value of Syntonics. Elaborate on this. The response comes, you put your finger on the central puzzle of Syntonics. As a developmental optometrist, you recognize that a clinical paradigm doesn't survive for nearly a century from Spitler to today, unless it contains observational truths, even if its explanatory mechanism is flawed. The nuggets of truth likely arise from real, measurable, visual, and neurological phenomena that get misinterpreted within an outdated theoretical framework. Here are the most plausible nuggets that lend Syntonics its enduring face validity. So nugget number 1, light wavelengths do have differential biological effects, but not via autonomic balance. This is the most important nugget. The idea that colors are just psychological is false. Established fact, different wavelengths penetrate tissue to different depths and are absorbed by different photoreceptors and chromophores, so like melanopsin, cytochrome C oxidase, and mitochondria. There's a real effect. Broadband blue light suppresses melatonin, shifts circadian phase, and increases alertness. Red near-infrared light, 660 to 850 nanometers, can improve cellular energy metabolism via photobiomodulation, or PBM, in retinal and cortical tissue. The misinterpretation here is that in Syntonics it attributes this to a vague sympathetic-parasympathetic balance. The truth is more specific. Wavelength-dependent effects on circadian timing, mitochondrial function, and non-image forming visual pathways, for example, the intrinsically photoreceptive RGCs, or retinal ganglion cells, to the suprachiasmatic nucleus. A clinician observing real patient changes after colored light exposure is not imagining everything, but the mechanism is not Spitler's. Nugget number 2, light affects accommodation and vergence through non-color pathways. So for a developmental optometrist, this nugget feels especially tangible. It's an established fact that luminance, brightness, and chromatic contrast drive accommodation and vergence responses. For example, longitudinal chromatic aberration, or LCA, means the eye focuses red light slightly behind the retina and blue light in front. This is a real measurable optical phenomenon. There's a real effect where a brief exposure to certain colored filters or lights can temporarily alter tonic accommodation or vergence posture, the red fixation effect in microstrabismus. The misinterpretation where Syntonics claims color itself is therapeutically rebalancing autonomic tone. More likely, any transient improvement in accommodative or binocular function after colored light exposure results from A, changes in retinal illuminance and depth of focus, B, alteration of fixation disparity pattern, C, nonspecific arousal effects via melanopsin pathways, and D, a clinician seeing a child with convergence insufficiently, briefly improving after light, may be observing a real sensory motor after effect, then erroneously generalizing it to a broad healing mechanism. Nugget number 3. The placebo effect is not just psychological, it produces real neurological changes. Dismissing placebo as not real is a mistake. The placebo effect is genuine brain-body phenomenon that can alter pain, fatigue, accommodation, and even visual acuity. It's an established fact that placebo activates prefrontal cortex, endogenous opioid and dopamine systems, and can modulate autonomic outflows. There's a real effect where a patient who believes colored light treatment will help their amblyopia or asthenopia may experience reduced symptom reporting, improved attention during subsequent vision therapy, and even objective changes in binocular function due to altered effort and arousal. The misinterpretation is where the clinician observed patient improved after Syntonics and attributes it to specific wavelengths, neurological effect rather than to expectation, therapeutic ritual, or increased clinician attention. In your own practice, you have likely seen patients improve after interventions that have no plausible direct mechanism. That does not make the improvement unreal. It makes the explanation wrong. Nugget number 4. Structured, relaxed visual attention has non-specific therapeutic value. Syntonics typically involves a patient sitting calmly, eyes open or closed, with a specific color illuminating their visual field for 10 to 20 minutes at a time. It's an established fact that reducing visual stress, decreasing saccadic load, and allowing time for spontaneous retinal adaptation can temporarily improve contrast sensitivity, reduce photophobia, and lower subjective visual fatigue. It's a real effect that any 15-minute period of quiet, structured visual rest, even with a neutral gray light, may reduce accommodative spasm or improve fusional vergence ranges simply by allowing the system to reset and rest. The misinterpretation here is that improvement is attributed to the specific color rather than to the non-specific rest and focused attention. A proper sham-controlled study, which Syntonics lacks, would use a broadband white light of equal illuminance and the same treatment duration. Without that, clinicians cannot distinguish wavelength-specific effects from general rest, attention, or placebo. And nugget number 5, anecdotal miracles occur in every medical field, even for ineffective treatments. This is an uncomfortable but true fact. Clinicians in every era have reported dramatic improvements after bloodletting, homeopathy, or electrotherapy. These reports are usually honest but systematically misleading due to the following factors. Number 1, regression to the mean. Patients seek care where symptoms are at their worst. Improvement is statistically expected regardless of treatment. Natural history. Many visual conditions, for example, intermittent exotropia in childhood, mild accommodative infacility, these can fluctuate or remit spontaneously. And finally, co-intervention. In practice, Syntonics is rarely used alone. It is typically combined with vision therapy, lenses, prisms, or home exercises. The active ingredient may be other intervention. The nugget of truth is that patients do improve. The error is causal attribution to the color rather than to time, attention, co-therapy, or non-specific effects. So what's our takeaway in all this? You can remain objective and intellectually honest by acknowledging that yes, patients sometimes improve after colored light exposure. That observation is real. No, that does not validate Spitler's mechanism. The mechanism is likely non-specific, placebo-mediated, or mediated by established photobiological pathways, circadian, melanopsin, PBM, that have nothing to do with autonomic balance through color as described by Spitler. The scientific task is to assign sham-controlled masked trials with active comparators, for example, equal luminance white light, equal duration rest, or vision therapy alone, or even meditation as an alternative, to isolate, and this would isolate the specific effect of color. I'm going to leave a summary table for you to look at. You can pause your screen to have a look at it, as well as a reference to an article called Neurophysiological Analysis in Different Color Environments of Cognitive Function in Patients with Traumatic Brain Injury. And this is an example of good research in the effects of color, if you want to call it photobiomodulation, in the instance of brain injury. This is good science. It's a good model for the College of Syntonics Optometry to follow if they want to move forward at all. Anyway, I hope you found this useful, and I look forward to seeing you in the next one in the series.